I'm Eric with Human Movement Lab. This is a video on why the diagnosis of bone on bone as a description or explanation for the cause of knee pain is incorrect 98, 99% of the time. So we hear this all the time, especially as people get a little bit older, 40, 50, 60, 70. It increases even though you hear it in younger people as well, but we hear it enough that I just want to explain why that's not an accurate description of the cause. So basically, the knee joint is one, after the low back, is probably the most common pain site issue for people. And the background of why that happens is people lose hip mechanics, where daily activities, or especially sports or exercise activities, the forces that we deal with, the stresses that we deal with from ground forces or impact or cutting or jumping or accelerating, those are primarily supposed to be absorbed in the trunk and in the hips. So these impact forces are going obviously through our foot up our leg, but we're absorbing them up basically around the pelvis if everything's happening the right way. But so much of the time people lose these proper movement patterns and mechanics, and so these stresses that are supposed to be being absorbed in our trunk and hips end up going into other parts of our skeletal system like our knee and causing pain issues. But that doesn't mean there's something wrong with the knee. It's a totally healthy knee. It's just being put under inappropriate stress. So the theory behind the bone on bone idea is that, oh, you don't have any cartilage in there, so that's why you're experiencing all this pain. And what I'm saying is, the reason you're experiencing that pain is because you're putting your knee joint under inappropriate stress, and it wouldn't matter if you had 5 times the normal amount of cartilage. You're still going to experience knee pain if stresses that are supposed to be absorbed elsewhere are going into your knee. All right? You could literally have 5 times the amount of cartilage, your knee is still going to hurt. If you look at the picture over my shoulder, you can see that the knee, from a certain perspective, is a pretty basic joint. There are 3 bones that make any contact with each other at all, and that is the femur, which is your thigh bone, one of your 2 shin bones, your tibia, and then your kneecap, which is your patella. And if you look at the picture, you can see the meniscus separates the femur from contacting the tibia. You got your medial and lateral meniscus, and there's no touching between those bones because of the meniscus in there. Now, some people have had a part or all their meniscus removed, or it's just not there for other reasons. Extremely small percentage of the population has that issue, and even with people like that, if they have proper hip mechanics, it still is not going to cause any problems because you're absorbing the stresses in the right way. You do have articular cartilage kind of coating the surface of the distal end of your femur and the underside of your patella and the proximal top side of your tibia. And if you look, I've got a model here of this is a left femur and a patella. And the way the patella or kneecap fits, it fits like a puzzle piece. The underside of the patella, I don't know if you can see the detail in this video, it's not flat, it's kind of grooved out, and it fits just like a puzzle piece in this groove of the end of the femur, right? So there is cartilage on both sides here. Now, for many different reasons, you could lose a little bit of this articular cartilage, but what I'm saying is, if your hip mechanics are correct and you're absorbing stresses the right way, it really doesn't make a difference. So when we hear people say, oh, my knees are killing me, I can't do this anymore, I can't do that, I can't play basketball, I can't play tennis, I can't play golf, or when I do it hurts. And we're hearing this from people in their 40s and 50s and 60s. And every time they come in and we do an assessment, they have, in the first 10 minutes, we're finding 5 or 10 just drastic and severe movement limitations and dysfunctions that are a much more likely explanation of their knee pain than just saying bone on bone, oh, I'm missing the cartilage, right? So people have severe limitations in hip mobility. They don't have hip hinge mechanics. They have left-right differences. They have all sorts of stability problems. And this is every time we hear that somebody's been told by somebody else that they're bone on bone, right? So my challenge to anyone watching this video that is dealing with a similar situation, find a professional that can put you through some movement assessments that checks hip mobility, the straight leg raise, the toe touch, that checks different postures of mobility and stability and works to rebuild hip mechanics, the hip hinge. And the hip hinge is what gets you to load weight and forces into the right parts of your body during daily activities and exercise. That's the way to spare your knee from being put under inappropriate stress. So we're in Huntington Beach. If you're local in the area, you can come on in, schedule an assessment and consultation with us. They don't cost anything, and we'll give you a whole list of information that's what we find out is your reason for why you're having issues and what your movement fingerprint is. But if you're not in the area, still reach out, because we have a great network of people all over the country that we can put you in touch with somebody that can help you figure this out. So bone on bone, I challenge you. I don't think it's a valid explanation for your knee pain. If you want to accept that challenge, clear all your movement problems, prove that you don't have any measurable movement problems and that your hip mechanics are fine, and then I'll make another video. I'll be embarrassed and I'll just apologize. But I really think that every single person needs to get more information. We can help you out. Shoot us an email, check social media. Thanks.